I'm Howard Schubiner. People ask me all the time, are my symptoms neuroplastic or not? How do I know? And I use the same method with every single person, which I'll describe to you. It involves two steps. Number one, I want to make sure that there's no serious structural damage problem, which surprisingly is usually relatively easy. And the second step is to what I would call rule in or confirm a neuroplastic problem or condition or symptom. And if the first step shows it's clearly a structural problem, we're not going to the second step. So there's a big difference, right? If your heart rate is rapid, it can be from having stress or it can be from a heart problem. One's neuroplastic and one's structural. If you have a headache, if it's from a busy workday, it's neuroplastic. If it's from a brain tumor, that's structural. Now, people always want to know, well, can it be in the middle? Isn't it always in the middle? Isn't it sometimes, or isn't it always, or almost always part of both? It can be on occasion, and sometimes there are situations where I'm not sure, and that certainly can happen. But what I want to describe for you today is how to be sure most of the time. And when I say most of the time, I'm talking about 90 to 95%. Okay, so, back pain is one of the more common things we see. I just wanted to throw this slide in here to help people recognize that when someone tells you you have back pain from one of these things, it's not true. These are not the cause of chronic back pain. If you sit in the same chair for hours on end, your butt's going to hurt. You have to move. Your back may be a little stiff, but when you get up, it'll go away. But chronic pain due to these things, not true. Imaging findings on an MRI of someone's neck or back will often show bulging disc, degenerative disc, spinal stenosis, spondylolisthesis. All those things are normal. All those things are seen in people without pain. So in that case, when that happens, what I say to myself is, well, let's not assume that those are the cause of the pain, because that's what most doctors will do. If you have neck or back pain and you get an MRI, it shows degenerative disc disease, bulging disc, spondylolisthesis. They'll say, oh, that has to be the cause of the pain. They shouldn't assume that. Could it be the cause of the pain? Maybe, but we shouldn't assume that it is. If someone has a tumor, a fracture, an abscess, something like that, then that's a different story. But those are quite rare. So we're talking 90%, 90 to 95% of the people with chronic back pain and neck pain do not have a structural problem, even though 98% of them, roughly, depending on their age, will have an abnormal MRI. And now here's the funny thing is that is also true for shoulder pain, hip pain, and knee pain, and foot pain, ankle pain. And this has been shown in many studies where if you take X-rays and MRIs of people's shoulders, hips, knees, and ankles, you will frequently find labral tears, mild arthritis, moderate arthritis, arthritic changes. You will frequently find impingement. You will find a lot of findings that are also seen in normal people. So once again, when we're talking about joint pain, we shouldn't assume that it's structural just because the MRI or the X-ray is abnormal. Sometimes I certainly will find that the MRI is dramatically abnormal, grossly abnormal, and oftentimes that can certainly be the cause of hip pain or knee pain or shoulder pain. But most of the time, you're getting mild changes. So that's the first thing. The second thing in terms of the structural issues is to say, well, what are the diagnoses that people have told me? So now we've got, the doctor said I've got irritable bowel or fibromyalgia or migraine or long COVID or chronic Lyme's, or the doctor said I've got bulging disc and degenerative disc or arthritis in my joints. Then we know we're not going to assume that those are the cause. We're going to go to the second level. And now we want to get to what I call famously, or I think it's famously, I don't know. We've written it up in journals now, the FIT criteria. So what are the FIT criteria? Functional, inconsistent, and triggered. Is the pain or the symptom functional? What does functional mean? Functional means it's not caused by a structural problem. That's what the term means in medical. So if someone has a movement disorder like dystonia. You go to the neurologist, they say functional neurologic disorder. Well, it's got functional in the name. That means it's not structural. If someone has Parkinson's, that's not functional. That's Parkinson's disease, right? Someone has ALS, that's not functional. That's a neurologic disease. Okay, so how do we know if something's functional? Well, we take the clues that are on this slide. The clues are, it began out of the blue. There was no injury or anything. It persisted after an injury healed. Someone wrote in, we said they had neck surgery 3 years ago. So the injury was 3 years ago from the surgery. Injury is healed. So why is there still pain? Most likely neuroplastic. It's in a distribution pattern that's symmetric. The brain's danger signal is really good at making symmetric symptoms. And oftentimes one of the clues to that is, well, the pain's always on my right side of my back, but every now and then it goes to the left side of the back. That is very significant. It's always on my right foot, but sometimes it's also on the left foot. That's very significant. So I pay close attention to those kinds of details. The symptoms occur in a wide area, like the whole side of the body, the whole half of the face, the torso, the whole half of the head. These are wide areas that don't fit with a structural disorder. The symptoms are spreading over time to different areas of the body. They radiate to the opposite side, so it's from the left side of the neck to the right arm. The left neck to the right arm. That doesn't make sense. The nerves don't go that way. The symptoms are occurring in many different parts of the body, and often they're tingling, electric, burning, hot, or cold. So these all suggest that it's functional. So how many of these do you need to confirm a neuroplastic condition? Well, you need one really good one. But most people have more than one. But nobody's going to have all of them. If you think you need all of them, you'd be mistaken. That can't happen, or it can happen, but it's rare. You need a couple of them that make sense, that are good. And I'll give you a couple examples of that in a minute. Okay, so functional, F. Inconsistent, I. The symptoms shift from one location of the body to the other. They're inconsistent. It's inconsistent with time of day. It's worse in the morning or worse in the evening. That's inconsistent. Structural disorders don't do that. The symptoms occur after an activity or after exercise rather than during. That's inconsistent because a structural disorder will hurt more when you use it and it'll stop hurting when you rest it. So it's the opposite, right? Its symptoms occur when you think about it or when someone asks about it. Classic, right? Symptoms occur more when there's more stress. Symptoms go away or are minimal when you're in joyful or in distracting activities or on vacation. Or sometimes they get worse on vacation, depending on the situation, depending on, what's going on in your life or who you're on vacation with. I saw a woman who had no symptoms on vacation, 2 vacations, and the third vacation, the symptoms were way worse than normal. And that had to do with who she was with. Symptoms are minimal or non-existent after certain therapies that are what I would call good and placebo therapies, like massage, chiropractic, Reiki, supplements, acupuncture. You say, well, I get a massage and it goes away for a week. That's the neuroplastic clue, okay? Same with acupuncture, et cetera, and energy treatment, okay? So inconsistency is a really powerful way to diagnose, to confirm neuroplastic symptoms. Certain activities, when I walk, sometimes it hurts a ton when I walk, and other days when I walk, it's not so bad. That's inconsistency. Sometimes when I stand up, or when I bend over, or when I twist, it's there. Sometimes it's not there. Consistency, right? Those are very powerful, and you only need one really good one of those to confirm a neuroplastic diagnosis. Okay. And the last one is T, triggered by innocuous stimuli. So, triggered by foods, triggered by smells, sounds, light, computer screens, changes in the weather. These are things that rule in a neuroplastic condition. Symptoms are triggered by anticipation of stress. Symptoms are triggered by imagining, engaging in the triggering activity. This is what I call provocative testing. Powerful evidence. Symptoms are triggered by light touch, or wind or cold. Okay, so when you put together all of these things, you put together the structural part, the first part, you put together the life story, you put together the functional, the inconsistent, and the triggered, you do all that, you're going to know 95% of the time. It's very clear. I mean, I've been doing this work for a long time. And when you take the time to look at all these factors carefully, one at a time, you know it's very, very obvious. So, the other thing that I want to talk to you about are click moments. Kelly, one of my very first patients, had headache for 12 years, horrible headaches every day, all the time, never varied. She goes on vacation and her headaches are still there, but as soon as she gets home, the headaches jump way higher. So there was a time where it was like, gee, it was there when I was on vacation, but when I got home, it skyrocketed. That's a click moment. That was her moment saying, wait a minute, why is that? There's something going on here that's not, doesn't fit with the structural problem. It should be the same all the time, but it varied. Gary, someone I met just last year, he had a leg and foot pains so bad that he couldn't sit because of his leg pain, butt pain. He couldn't stand because of his foot pain. And so he walks into a pharmacy one day and his pain's like a 5. It's pretty bad, but not horrible, horrible. And he walks into the pharmacy, sees a long line. And so as soon as he sees the long line, he knows, oh my God, I've got to stand in that line. And as soon as he sees the line, his pain jumped from a 5 to a 9. And he went, TF, holy crap, I can't believe it. It is my brain. That was his click moment. And that one moment gave him all the evidence that he needed because he understood it. The only thing that changed was his brain when he saw the line. Alicia, Dr. Batson, one of my favorite people in the world, she had 10 years of hand pain and hyperacusis and a whole range of symptoms. That means she couldn't work as a doctor for 10 years. And she went to one of our websites. She started reading it and she's like, oh my God, that's it. It's obvious. No one ever told me. Click moment. Richard is a guy who's a doctor who had sciatic pain. And he was one of those in the middle. Well, it's in the same area where the disc is. So I said, well, maybe it's the disc, but let's examine more. Let's get more evidence. So we went through all the fit criteria, little by little, one at a time, and it wasn't clear. We weren't sure. It seemed like it could be structural, but he'd been through all the structural treatments and nothing had worked. And so then I said, well, let's wait. Let's just get more information. So a few weeks later, he emails me, he says, oh my God, it happened. I was walking up the stairs and I noticed that when I walk up the stairs, I have a certain amount of leg pain, sciatic pain. But when I carry a cup of tea, the pain is twice as much. Why is that? When I'm carrying the cup of tea, it was like, oh my God, cup of tea. Well, what's that doing? It's creating tension because the tension is to not spill the cup of tea, but the tension's in my arm. The tension's not in my back. And the tension is in my brain to not spill the cup of tea. Are you with me? And when Richard saw that, he goes, oh my God, TF, I can't believe it. That's my click moment. And then he got better. He got completely better because at that point, he had the diagnosis. Fiona's a woman started in her childhood when she was 9 with horrible pains in her legs and her arms and everywhere, and no one could diagnose her. She had pains for 10 years, and then fatigue set in, and then she had fatigue on top of the pain for 15 years. Horrible, life over. And she got a this is funny, right? She got an ad, pop-up or whatever for curable. And she goes, that's a bunch of crap. That's ridiculous. My fatigue is not my brain. My fatigue is my mitochondria. I know that because I've looked at all the research and they tell me I'm never going to get better. So anybody who tells me I can get better is lying to me. And these people at Curable are horrible. So then she gets another ad for Curable. And now she's really angry. What are they doing? Why do they keep sending me this stuff? I hate that. I hate them. And she gets a third one and she says, all right, I'm going to join Curable to prove that it won't work. And what happened? It worked. She started reading, she started looking at it, she found the inconsistencies. She learned how neuroplastic conditions work, and she saw that her symptoms fit, right? F-I-T, fit that criteria. And then she's now completely better. And the last one I'll mention is me. I had Achilles tendonitis, so I had this pain in my right Achilles heel, and My brother's an orthopedic surgeon, said, Howard, it's not mind body, it's Achilles tendonitis. Do these exercises and wear a heel lift. So I wore the heel lift, but I didn't do the exercises. Why? Because I'm a doctor and doctors make horrible patients. So I don't do the exercise. But anyway, I figure it's going to heal, right? I keep moving. I keep doing my exercise. I keep doing my Zumba classes, my body combat class, all that stuff, because I love that more than life itself. But anyway, it's still hurting. So a month goes by and I'm like, Jeff, my brother, Jeff, how come it's still hurting? He says, well, you're doing the exercise? And I go, no. He says, well, do the exercise. I said, okay, I will. But I don't. But anyway, I figure it's going to heal. And then 2 months go by. Why isn't it healed? Or is it healed, but why is there still pain? So I was stuck in the middle. I didn't know. Is it still an injury and it's still there because I'm not doing the exercise that I'm supposed to? Or did it heal after 1 month, which is to be expected, and now it's neuroplastic pain, right? I didn't know. So now in the 3rd month, I'm thinking like after 3 months, it should have healed by now, but it's still hurting. And then I was on a golf course getting ready to play, and I was warming up. I had a lot of time. Everything was great. I felt happy. And all of a sudden we go, hurry up, you're on the tee, hurry up. So I hurry up, and I'm hurrying up, and I'm walking fast, and I'm stressed because I wasn't ready, and blah, blah. So anyway, I take one step, and this one step, I got the sharp, severe pain in the right heel, more than the pain I've had since the beginning. And I'm thinking like, whoa, did I re-injure it? Did I do something? And then I stopped and I said, I didn't, it was just a step. I didn't twist it. I didn't step funny. I didn't step on a rock. Nothing happened. It was just a step. But it occurred at a time when I was stressed. And that was my click moment. And I realized, aha, I've got it. Now it's neuroplastic. And probably, maybe, it might have been structural at the start. I wasn't sure. Now it's definitely neuroplastic because that moment gave me all the information that I needed. And I urge anybody who's feeling like they're stuck in the middle, feeling like they're not sure, to review all these criteria and to look for these moments when the pain or the symptom goes up or down in relation to visiting a relative or a vacation or a certain step or carrying a cup of tea or walking into a pharmacy or whatever it is. Pay attention to those because those can give you the most important information that you need.